Hope you like that nice new intro. I'm Dr. Michael Schick, and here's the ultrasound of the week. You got a trauma patient coming in, multiple gunshot wounds. You do a fast. I'm going to skip the cardiac portion, which was negative for pericardial fluid. But in the right upper quadrant, we see this, which demonstrates not a clear pocket of free fluid, but there is this very hyperechoic portion within the middle of the liver. We zoom in to get a better look, and there's a hint of free fluid in Morson's pouch, but that hyperechoic portion in the liver is what's really apparent. And what that is actually air within the liver from where the bullet traversed the liver, leaving a large liver laceration and air within the liver. Kind of an unusual finding. And then we go to the left upper quadrant. We see free fluid around the spleen, indicating free intraperitoneal blood. Also probably some fluid in the left hemithorax. Go to the pelvis real quick. Again, free fluid in the sagittal plane. You can see bowel hanging out there. Just cephalad to the bladder. And then in the transverse view, also posterior to the bladder, we can see free fluid as well. The FAST exam is not the perfect test to rule out any large injury in the penetrating trauma to the abdomen. However, it can identify some pretty serious pathology, and especially in the patient that is unstable and requires resuscitation at the same time, like this patient. When identifying these large polytrauma injuries, the more information you can gather, the better. It may change how you resuscitate the patient. It may change the surgeon's decision to wait for imaging or take the patient directly to the operating room.